这是项目的背景，也是由美国新墨西哥州阿尔伯克基新墨西哥大学的专家 Aurora 博士所开发的，也是为了能够使得在关于疾病方面的知识得到更好的推广，不仅仅限于可能自己所在的区域。所以说的话，我们整体的这样的一个模式的话，它并不是一个远程医疗的模式，而是
It's
通过
not a telemedicine,
能够将最佳的一些实践
but instead telementary a guided practice model where the participating clinician retains responsibility for managing the patient.
那么整个的这个项目的话，我们会有比如说像
And this project links expert specialists
专家组的核心专家团队，
like Professor Pan or
是整个项目的重要的参与方。
their
那么每次的项目
important participants of this workshop.
先是有大概15分钟左右，但是可能
Now for each session we have 10 to 15 minutes lecture at the start.
先是有一个小的讲座，在这个讲座之后呢，我们会进入到
And then we have a Q&A
在这个环节 稍微追溯
part.
非常希望大家可能的话可以开
And we hope that you can
去进行分享
turn on the microphone to
或者有关于乙肝相关的
talk with
分享
our specialists and colleagues
当然也可以
and share your ideas or your problems.
与我们进行互动。那么在整个的这个分享的环节当中呢，我们会谈到一些患者管理的这种方法。
And we'll talk about some
这个分享的话呢，也是能够帮助大家更好的去对于患者进行照护。那么最后的话，我们也希望表达我们的一个愿望，
and we want to
助力大家在乙肝的疾病管理和相关科研等方面的这个工作。谢谢大家。那么，就是
need to introduce our specialist,
是美国纽约大学医学院
Professor Pan.
医学中心肝病科临床的郑教授，博士后导师，
He's the professor of the NYU
高层次人才计划
Longny Health,
美国肝病学会乙型肝炎委员会的主任委员，
and he's
肝病学会
leading
乙型肝炎学会指
FAA SLD and co-author of the 2023 Hepatitis B Guidance.
发表 SCI 期刊论文120余篇。
He has published more than 120 SCI papers
发表论文，
and as the first author or communication author on
并分会的国际交流突出贡献奖，
Albany.
获2016年呢获美国医师学会授予
And in 2016, he
2018年
won the MACP, and in 2018,
医学杰出贡献
he won the James D. Booth Memorial Award for distinguished contributions in preventive medicine.
那么这个主持的工
We're
作
very honored to have
好的，非常感谢
Professor
潘
Pan
老师
here.
的介绍。那下面刚才我们观众都已经做了一个 pre-test， 对不对？然后呢，今天我
And our audience have
会进入到
answered the pretest.
演讲嘉宾的一个
Now
授
let's
课环节。
move
在这个
on
授课环节中呢，我想非
the
常
lecture by
来
our
简单地介绍
specialist.
一下来自美国纽约大学医学院的潘医生。潘医
Now
生
let
是一位
me
享有国际
introduce
信誉的
our Professor
肝病
Pan,
学专科的医生，同时他也具有多个
the leading
他
expert
在
in
这个卫生肝病
hepatitis
领域呢是有多
hepatitis disease.
并且参与领导了多个国际的多中性临床实验的这么一个
And
研究，并且拥有非常多的重量级的文章发表在国际顶尖期刊的杂志上面。他的专长是在于慢性乙肝的管理、肝硬化的
He's a specialist in
好，那
chronic
下面我们就把时间交给
CBV
潘医生。Over to you, Dr. Pan.
and relative barriers?
能听到我说话吗？
可以的，没问题。
好，谢谢。麻烦您给我分享的权利。我要分享一下幻灯片。
Let me show the slide here.
教授，您可以看，
可以分享的是吧？
可以直接分享的，可以直接分享的。谢谢。
好的，我们看到您的分享了。对，可以点全屏模式进入就好了。
好，谢谢。
好，谢谢。
首先非常感谢两位老师对我
thanks for the introduce.
真的所说的那些都已经是过去的事。我们今天呢很高兴，就是说我们在一起
And that those achievements are the past. And today we'll focus on the screening and barriers.
首先呢是从筛选开始的。那下面呢15分钟。
In the next 15 to 20 minutes, I would like to talk about the current technologies and screening and the barriers. I'll start by introduce of our experts. He's Dr. Wang Ling. He's a professor and chief physician from the Department of Infectious. And Dr. Chen Xin is an associate professor of University of Paris. Now I'll talk about how we screen and the barriers we met. Here is a declaration of interest. And why it's important that we hold this workshop. HBV is an important disease. In China, and maybe we have relatives or friends who have HBV. According to WHO, 296 million people living with chronic HBV. And the newest data show in China, there are almost 100 million people with chronic HBV. And so many patients can bring many problems. And leading cause of cirrhosis and hepatocellular carcinoma is a because this disease affects so many people's health, and the WHO made the goal of elimination of HBV a public health threat. But we have many barriers to achieve this target. By 2030, we want to reduce 90% new infections and 65% reduction in death. But the great challenge is about treatment. We can see the four targets, the four goals. Not only 10% of the patients are receiving treatment. That is to say, only 1 or 2 million patients are getting treatment. And about blood safety and vaccine coverage, in China, we did a great work. And why should we consider managing HBV? In endemic countries like China, the CBV are mostly happen in mother to baby at time of birth and contaminated. Let me introduce the risk of developing CHB by age and exposure. The public
Well, as long as the infection is over 6 months, well, the definition would be the chronic one. And for the chronic one, it will easily appear in the period of infant, especially for the young children less than 1 year old. So at this time, it is very easy for the acute ones to become chronic ones. So for the acute HBV, well, the prognosis generally, it is very good. Very few cases would develop to severe HBV, severe CHB. So mostly, well, the prevention method for the CHB, it is the vaccination and also the prevention of the mother-to-child transmission myth. So the myths of HBV transmission in China, well, the main myth is the mother-to-child transmission, but also there are many other ways. Well, also like through the sexuality or the IV drug use. But because of the less understanding of the transmission myths, so many people, they have this misunderstanding for the different ways of the transmission of HBV. So they will have fear for the HBV, for the CHB patients, like the items listed above, like the common use of the bowls and chopsticks, or kissing, sneezing, or coughing, or air, food, water. Well, for these ways, they will not be transmitted. The HBV will not be transmitted through these methods, through these myths. And also, if we can divide the infection or non-infection according to the symptoms of the patients. Well, because predominantly the adult infection will show some symptoms. So here we could see from the curves the opportunities of the symptoms of infection. Well, for the adolescents or children with an older age, they will have symptoms. So here we can see 2 kinds of information. Well, firstly, if we want to find out with the patients with CHB, especially with the very young patients, we should not rely on the symptoms. We should not wait until the symptoms appear that we do the screening. Because for the opportunities for these patients to get this CHB, they get the disease in the asymptomatic period. If we cannot rely on the symptoms, do you have a question? What should we rely on to decide if we should do the screening for the patients? So from this chart, we could see if we do the vaccination. Before the vaccination, in our country, in China, I think it is after the 1990s, we have this EPI plan, and to divide the population with age. So 2 to 3 decades ago, we started the EPI. Until now, for the people with the age of 20 to 30 years old, less than 30 years old, for this population, for these young people or the people to the middle age, for this population, I think they have very few opportunity to get the infection of HBV. So if you want to ask the question, where is the high-risk population? Well, firstly, we should know that if we want to find the risk before the age of 5, it is very rare to find the high-risk population in the people less than 30 years of age. So the older the age, the risk would be higher. Here we could see the percentage is average percent is 6.7%. And also in the Southern China, it can be as high as 8 to 9%. So in the Northern China, the incidence would be lower. But for the people with older age, here I have a reminder for you. The older the age, the higher the incidence of infection. And we could see the incidence just mounted to over 6%. So if the age is a main risk factor, there are other risk factors, like for the risk for the transmission from mother to child. Well, here in China, we have this medium level of transmission incidence. So here in the areas with medium to higher incidence of transmission, so mother to child transmission is a clear risk factor. So if a parents they are infected, well, their children would be in a very high risk. And also through the drug use through the IV, and also the history of STD, and also multiple sexual partners. And also they have this they contact from medical resources, like the blood transfusion or dialysis. And also some of the traditional medical treatment methods, like acupuncture, like cupping. If the instruments, they're not disinfected very well, they also can be a medical resources of infection. And lastly, we should be alert that for patients with elevated ALT or AST levels of unknown origin, for these patients, they are in the high-risk population. But for the universal HBV screening, well, it is risk-based. In Thailand, it is moving towards the universal screening in people born before 1992. And I just participated in the formation of the outline and guidelines in the US. And we just want to make the universal screening more popular. Also, we have this administrative guidelines for the HBV and CHB. So now they want this principle that to screen all the patients that should be screened. So it is not to the level of a universal screening, but we should do it as much as possible. So for the universal screening, so what's the difference between these two principles? For the people who should do the screening, we should have this request. How to set the request is also a problem. So to my own opinion, I want to advocate, I want to promote the universal screening. So here for the screening, how should we do it? It is very simple. No matter in China or in other countries in the world, For the medium level of developed countries, we can have the blood tests, for the serology biomarkers for HBV, like the HBsAg, HBcAb, and HBsAb. So many colleagues and experts, they all know that for the surface antigen, it is most important. If it shows positivity in this test, it means that the virus is already in your body. And for the other tests, like the HBcAb or HBsAg, HBsAb, well, we should wait all the results to come out? Well, for the US CDC, they just want to support the principle that we take actions as soon as possible. So after the patients do the blood tests, if the HBsAg has already proved infection, should we do the first injection to the patients? Well, for the US CDC, they consider if we do the injection for the patients, there is no disadvantages. The vaccination will not influence the positivity of the HBsAg. And another advice is given by the US CDC. If we give the first injection, at the same time when we do the blood test, it will still have the protective effects for the patient. So for some experts, they insist to wait until other results coming back. So there is pros and cons. So because if we wait, there will be the opportunity, there will be the risk that the patient will not come to the clinic for the second time. So the opportunity for early protection would be lost. So to my own opinion, I think we should do the vaccination at the same time with the screening. So we have just finished about the building of the universal screening, especially when we want to vaccinate the patients at the same time with the screening, especially in countries that has not initiated the expanded vaccination plans. So what about the advantages? Well, for the early screening, it will save lives. And finally, I think if this patient just developed from a simple infection to liver cancer, the vaccination can significantly stop this process. And also, we have different medications in treatment of CHB, and the prices, they have reduced to a large extent. So for these patients, after the antiviral treatment, it is an acute reduction of this incidence of liver cancer and cirrhosis. So we do not emphasize the point that we wait until the occurrence or the appearance of the symptoms. We should not wait until that time. We should just do the screening at very early time. So the symptoms is not a decision key. We should do the screening as early as possible and as much as possible. And why we know this necessity of the screening? Because there are still some barriers from the culture-specific perspective. So now let's talk about the solutions to these barriers. Like we have some experiences accumulated from the actual cases. And also according to the literature published, we firstly understand that, well, the patients is the first reason, the first factor, because they have a very few understanding of this disease. And especially in China, we have this old regulations, the old policy that the HBV positive patients cannot be hired in some job positions. But now it is already abandoned. Also, the patients, they care about their privacy, also have this cultural beliefs and shame. And also, it is related to the policies, the old policies of the country, and also the treatment, especially the high price of the medications to treat HBV patients. It is not covered by the medical insurance. All these factors, they can be the reasons or the barriers. And how to salute these barriers? Well, we can have some inference from other countries like Thailand. They have education by the Liver Foundation and public health organizations to do the patient education. And also we can enhance the patient engagement, like through the medical prevention, the high effective medical prevention from the state level, especially for the young children. And also I have like a 30% of time in China to participate in the clinical studies. And I know that in China, for so many children, they have the first vaccination in hospital after birth. But for some of the children, they just lost the follow-up. They just forgot to get the following vaccinations. So this is the problem that need to be dealt with.
We can improve the clinicians' understanding of this disease, so we can screen at the primary care visit, and some factors can affect the clinicians' decision, and some solutions to address this issue. We can improve awareness and finally to as the electronic health records and some new technologies brought by the COVID-19 prevention. Now we still we can set up a routine screening at the hospitals. In the New York state, and each patient has to be screened before they have the electronic health history. So the screening is for to recommend the patients to acquire to receive the vaccination. And some think they have received the vaccination, but they actually haven't. And in summary, first, HBV is a cold killer. Without the and if we think about the Wenchuan earthquake, more than 300,000 patients are killed by HBV each year. And some risk like now in China, we should screen the patients as much as we can. And I believe in the future that China can learn from the US and or the Thailand to screen more people and break the barriers. Thank you. Thanks for Professor Pan's introduction and he introduced this area and some differences between in China and US or Thailand. Now we get to the Q&A session. If you have any questions or ideas, please turn on the microphone or type it in the and we all welcome our colleagues to share their cases. And we have Dr. Wang Ling here, an expert in this area. And he also participates in ECHO project.
您那边好像摄像头没有打开。
好的，我开开。
好，潘教授好，王教授好。
对，潘教授好。
王教授好，幸会。
幸会。
对，你们两位应该是第一次在线上见面。然后下面的讨论的时间的话，我想交给潘教授和汪教授进行。
Now I'll turn over to Professor Pan and Professor Wang to share some experience in the guidance and treatment.
尊敬的，包括我们主办方的丁教授，以及我们的主持苏老师，我们的演讲者潘教授，你们好。这个课件呢，
to our colleagues.
讲过一次，但是呢，确实是温故而知新。刚刚听到潘教授的那个精彩的演讲。
I also talk about this topic, but today I learned something new. Before our audience post any questions, I want to.
经验是跨国界的您应该也是我们中国人吧？
是，我在中国读完本科，再到美国读博士。
是的，
I went to the US for my doctoral academia before. You are very familiar with the treatment in both countries. And to talk about the HBV prevalence is relatively high in China. And it's mostly by mother-to-child infection. So the most common is CBV. And thanks to the policies in China, the medication is relatively cheap now.
WHO 的这样一个目标
And to fulfill the targets
就是在您在美国那边
promoted by WHO,
方法或者就是借鉴的方法能够
can you recommend any
这种患者或者管理慢病的管理患者随访的这个依从性呢？
any advice?
非常好的问题，就是首先我们讲依从
This
性
is a
嘛，
good question, and
这
we
边的经验
can.
吧。就好几年前我们做过一些
Years ago, we
就是
did
给
some
病人服药的一些研究。
we did some research about the patient's medication,
这些
and
病人呢
in the United States,
50%
we
以上
found
呢
that
就不吃药了，
up
50%
to
就脱落了。
50%
就是在
patients
归根到底还是一个慢性管理，在乙肝病的
forfeited the
慢性
medication
慢性里面，慢性管理
after 2 years.
受挑战的一个原因就是说咱们都
So it's a
知道
very
无症状
challenging.
它的并发症出
And
现的
some
时间
are
比较长，
asymptomatic
没有危这个
and or
危险意
the
识。
treatment
那么
takes
当然
too
在
long.
美国呢，其实不存
So
在
they
这
just
个钱的问题。
so the
大部分
patients
病人不是有保险的话呢，就是
can't
这个
adhere
救助，甚至药厂有免费的药提供。所以在中国的话呢，您了解的比我多，我
in
能
China you know more
在
than
中国
me.
做3个月吧，一直在
As
北京
I know it,
也做过
for the 3
15
months
13
I worked in Beijing.
那我的观察，中国的病人呢，其实是多维度的
In my observation,
依从性
the patients and the compliance are is infected by many factors. Now the drugs, now the medicine are cheap, and this is not a barrier to the patients.
确实是个头痛的事儿。那么
But testing it is a headache for them.
解决了药物，解决不了检查，那么还是病人呢是会有很大的压力。我觉得呢，就是像
And now the testing is can be a pressure for the patient.
我在参加了厦门会议，亲自去了，所以跟各个专家讨论。
I went to the Xiamen conference,
这个检查费用呢，还是要通过国家的策
and
略
I think the testing fees
那么你抗病毒治疗
should be reduced by the country.
是最好半年要检查 DNA 吧，对吧？那么你现
For every half year,
运作的话
the patient should test for the
不是几块钱吃药的问题，再加上其他的肝功能的一大堆，还有太甲球蛋白啊、超声波怎么也要100多吧，是吧？所以你整下来呢，
the
这个是
testing can be expensive.
这是一个病人呢，首先是
This is the first
特别是
factor.
大部分的，虽然我们很多中国人都富起来，其实大部分的老百姓还是蛮吃力的。
Though our country is more wealthier now, but for many patients,
过1-2个月这笔钱出来去检查
1,000 or 2,000 yuan for testing
我觉得呢，就是就医的方便性
is still a burden for the patients.
下层医疗到3级医疗，所以呢，大部分的病人呢，他去还是到3甲医院
Most of the patients went to the
这个呢排长队等医
better hospitals,
有的是排队挂号。我觉得这些呢都是
and they have to wait in line
去
to
维持这个治疗
get
的一个比较
the
挑战
care.
性的东西。
This is also a challenge for them.
宣教的问题了，对吧？还有就是立法的问题了，是吧？
Also, the regulations and or the law.
肝的病人或者是有慢性病的病人可以
The patients with
我
CBV
们已经开始可以享受
in New York,
慢性
they
病
can
就是说你有慢性病的话，或者是你有家里有需要的话，你可以是
they can have a
雇主一定要付你工资，只要雇主是超过50个工人的，
cheaper
一定要
price.
付。
哦，
就说所以呢
这个政，策很好。
对呀，所以呢，
And some fees are paid by their
这种 有
employees.
职业感的、有使命感的人，要向政府去提出。我相信在座的有很多是优秀的，咱们
I
国家
hope some
说不定是人大代表。
I
我
hope
也希望你们在开人大会的话，就要提这些，确实要为老百姓要说出这些。
some of you can, some of our people can advise the government to reduce the fees for the patients. There is still a long way to go. Thank you, Professor Pan. And it's true that the prevalence is related to our country's development. As you said, to screen more people as many as possible, and the efforts and educate the patients is also important. When I was a young doctor, many patients the discrimination on the patients is common. I went to Africa. When I was in Africa, I also see the discrimination on the employment or in living. In the health test before we enter the schools or for employment, they get screened.
歧视以后呢，他说的好像现在我们卖乙肝的病人，这种有抑郁情绪的、悲观情绪的，好像没有那么感觉。
The patients with HBV with depression is more, much less now. In the 33 decades of, in the 4 decades of reform and opening up, our country is getting much better, and we should continue to promote the treatment and to help the patient.
比如说您提到的这个入学，还有这个
mention about the health test for school or for employment.
是不是可以从另外一个方向去考虑？你不要去立法，不要去只是说歧视的问题。 It
is not only about the discrimination. We should have the refinement to punish those people who discriminate those HBV patients. If there is a necessary screening and if there is a positivity result, and it just influences the final results of the recruitment of workers, well, from the state level, we should have this punishment for those people who really discriminate those CHB patients. So I think if we have this policies formed or have these actions taken from the state level, I do not believe there will still be discrimination in the society. So here, I think,
砍脚去避蛇的问题，对吧？
it is how should we just actually resolve this problem? How to screen? If after the screening, if the positive patients, they receive the discrimination, there is very strong punishment, then who still dare to discriminate those patients? So we should just not, because of this fear of the discrimination, that we stop the screening. This is not right, I think. So also I participated in so many domestic conferences. We may just think this problem from a different direction.
立法者可以
How to influence the policymakers? how to work from the other end of this problem. We may do better. We should do better. So if there is just a clearly stated laws or regulations to punish the people who discriminate, just we have this physical examinations for this item, they are just included in the greater general panel. But now we have this regulations that the people, they have a say to refuse the blood test for HBV. At least in our center, it is the real situation. We just give the right to the patients. I think it is not right because they do not have the medical awareness to make a decision. So if we want to do this, also we do this way, well, we will never eliminate the COVID-19. So we may think from this direction, we cannot just let the patients to make decisions instead of us or to interfere with our policies. Like I think, well, I do not say that everything happens in the US is right, but we can just take in those advantages that we can learn from the scientific experiences. They just regulate, they just have this regulation that they require all the students before they enter the school, they should have the screening for HPV. If they do not have enough or effective vaccination, they cannot enter the school, no matter to the middle school or high school or universities. So I think if for a middle school student, if this middle school student, this boy or this girl says, I do not want to do the screening, well, we just follow his or her willingness and there's no screening and let this student enter the school. But if the student is just a resource of HBV infection, well, this will be a very big risk factor. So I think there is no mistake. But we should have this regulation. We should have this policy to require all the students, all the people to do the screening. And in China is the very supportive country in the WHO and should also be a member that should also be very supportive for the policies of the WHO. We should vote to say yes, and we should just have this great mind to improve our policies. We just should not give the decision-making power or the right to the patients. Because the patients, they just lack medical awareness. Well, finally, they may blame the medical workers that they are responsible for the mis-screening for their disease. So this is the difference between the two countries. I think for this point, I agree with you for your point. So here, I also want to have a say for the now the conditions in Hong Kong. I think Hong Kong is like what happens in China, the other places in China. So we also have the screening plans, just as Professor Pan says, we have a different policies. We have this EUC, the organization to protect the employers as well as the employees. Well, if there is discrimination from the employer, well, there will be very, very strong refinement, the punishment for the explorer. So I think this is what has been done in Hong Kong. And also I have been a worker in the hospital in Hong Kong. So I also have noticed that for in this Commonwealth areas, I think if in China, before every surgery, there will be a panel test. And the panel test just include HBV, HIV. So In China, well, in the patients, well, they may have some medical transmissions for the HBV transmission, but in Hong Kong, I think they have done a lot of work to do the screening for all the patients that should be screened. So we do not do the screening before surgery, we just do the general precautions. With this principle, we just have this patients already infected with HBV to do this general protection to protect them from the transmission to the doctors. So if there is very severe, very clear clinical symptoms, that we just decide to do the screening for the HBV. So I think this is the difference between the practices in Hong Kong and other countries. So this is my comment from Hong Kong. Also in the US, well, we do not do the screening. And also for the CHB patients, well, if the cirrhosis can influence the process of the surgery, that we will do the screening. And for the HBV, for the CHB, it's not a contradiction for the surgery. So also for the perioperative, there is no regular screening for HBV. So we do not do it regularly. So I think Toby Shu, because you're in Hong Kong, and we are in the mainland of China, and as well as I know, we do not have the, because of the positivity of the biomarkers of HBV, it will not influence the operation. We have the policy, but for the clinical practices, I think for the pre-op panel test, they just include HIV, HCV, HBV, and syphilis. So we just do the screening to those population who should be screened, or the universal or general screening. And also in our center, when we, like in the Department of Infectious Diseases, and we also are doing a job to promote this conception to our patients, to do the patient education. That is what we are doing now, as long as I know. And also, I want to take a minute, and I listened to the part I'm interested in. I also have a question to Professor Pan. But before the students, they get into the kindergarten, or before they enter the school, they have this universal screening. And 2 decades ago, I have read a report about this US policy. They just clearly stated that for the entrance for the students and also for their entrance to the dormitory, they should not be discriminated. So if they have this universal or general screening, well, as their co-workers or their colleagues or their classmates, will they have an understanding about the actual information about this HBV infector? Well, the information is not known. Well, if the information is released, they will get the punishment. But if they just have the randomized allocation of the dormitory, well, they are all done blindly. Only the patient, him or herself, and the doctor, they have a knowing about the infection of HBV. If the student, they have this consent of this ICF forms, ICF signed, they can just give this information to specific people. So this is a comparison between US and China, but I think to my own experiences, for the protection of the secrets or the privacy of the patients, I think the US is doing a better job. Well, of course, China is doing much better and better nowadays.
我反复
Well,
跟他们
because I have seen a lot of materials from the patients. Well, they still have the patient's name on the materials,
到处飞的，
but I just
所以还是需要更多的
have stated a lot of times to my coworkers from China that we should protect the privacy of the patients. We should just put this as our priority to protect their privacy as well as protect their lives.
感谢王教授。
Okay, thank you, Professor Wang and Professor Pan. And we have a question from the audience. There's 2 questions about the vaccination of the HBV. Well, firstly, about the first injection, if the positivity result shows after the screening, then the first injection, what is about the effect of the first injection? And if it will just influence the positivity, the results of the screening. So for this, the Professor Pan, can you answer these 2 questions? When the answer is no, there will be no influence for the results, the positive results.
没啥用。
Well, for the first injection, it will be wasted. It will not influence the positive results. But because the vaccination is so cheap, so there's no worry about the waste. So, okay, so because of the time is limited, this is the end of our lecture today. And for the final section, and Mr. Ding will have this post test for all the audiences. Okay, Professor Pan. And there is also a question from the Nanjing Medical University. Can you just quickly answer this question? Okay, I will just briefly answer it about the regulation and the policy about the protection of the privacy. Okay, if just accept the patient and the doctor, anyone else should not have a knowledge about the results of the infection of HBV, including the spouse or other family members. So
医生呢是有义务去向你密接的人披露。
And the
但是乙肝不
doctor may have the
类一类的在里面，所以呢，我们对病人的解说就是说，我建
so
议
we'll tell the patient and we advise you tell the contacted persons,
但是我们不会透露。
but we as the doctors will not expose your secret. Thank you, Professor Pan and Professor Wang and Dr.
也是再次
Fu.
大家做一个预告，就是我们在接下来的3周
And
的这个
here is a preview.
请到潘教授
And
为
the
我们进行进一
next
步的
Wednesdays and
分享和讨论。
Saturdays, we'll invite our experts to
3次
talk about
大家有任何的问题都可以和潘教授
HBV.
和我
And
们
if
在
you have
中方的
any questions, you can
交流和沟通，包括大家
contact
遇到的
us
特别
and
情况呢，也可以与我们进行一个
chat
交流，
with us
来共同的分享在乙肝防治和治疗方面的
and share your
信息。 谢谢
experience
大家，那么就麻
or
烦大家
information in treating and prevention of
问卷，然后我们就结束
HBV.
今天的这个
Please
分享。谢谢潘教授
answer the post test.
谢谢大家，
Thank you.
哎，潘教授周
下周见
末愉快，下周见。
好，再见，再见，
好，再见。
再见。
See you
就
again.
麻烦大家再填写一下问卷，我们可能稍微2分钟以后我们就正式结束。